Lead time and length time bias. This video is a part of our series on epidemiology and biostats. My name is Dr. Wahab Fazal and let us get into it. So the first thing, let's talk about lead time bias. We'll understand lead time bias with the help of an example. Let's draw out the example. So we're taking the example of an advanced pancreatic cancer lifespan of an average patient. So this lifespan is around 1 year. So when the cancer forms and around a year later, they die. And unfortunately, there isn't a lot that we can do for it, supposedly, for this example. Let's say we are diagnosing people with pancreatic cancer around this time, right? We're diagnosing people around this time. They go on to live around 3 to 4 months. And then we have a new test come in that diagnoses people much earlier. Let's say it diagnoses people around 7 to 8 months earlier. So it gives this false perception of some increase time. So patients go on to survive around 12 months. Now scientists go on to say that, this new test is somehow increasing the survival time and we're treating it. But the problem is there's nothing that we're actually doing for this disease. Patients were going to die 3 to 4 months later because we're just diagnosing the disease earlier. Now we just diagnose the disease earlier and patients still have the same average lifespan, right? But it's just that false increased perception. So this is lead time bias. When you're diagnosing people earlier with a very aggressive disease, but you're not changing the survival time. You're not changing, you can't do anything for the patient. So you get this false sense of belief that for some reason because we are diagnosing the patients earlier, we're somehow treating the disease as well. We are not. This is an aggressive disease. We're not changing the survival time. This is just a false perception. We earlier had 3 to 4 months and now we're somehow getting 12 months of the patient just knowing that he has pancreatic cancer. So we're not actually increasing the survival time. This is lead time bias. You're getting a lead on the diagnosis of the disease, but actually you're not increasing the survival time. Now let us talk about length time bias. Now the concept of length time bias is very, very different. Lead time bias is usually for diagnosing people with the disease. That's why you had only one arrow. Length time bias deals with the population level, deals with a lot of arrows. Let's understand it with the help of an example. So we know that a lot of men get prostate cancer and very few people die because of it. The mortality of it is very, very low. It's a long progressive disease without symptoms, meaning the majority of patients just don't have symptoms for prostate cancer. So in the 1970s and 80s, we had this new test called prostate-specific antigen. We had this new test that was diagnosing people earlier with the disease, right? And we diagnosed a ton of people with the disease. And we started noting improved mortality. But what was the problem? As I said, very, very few people die in the first place. Very, very few people die because of it. It's not that improved mortality. It's just a good disease to have. People don't die either way. People just live with the disease without having symptoms. Let's understand this with the help of a similar illustration. So the first thing that I want you to notice is that in the lead time bias illustration, I had a single arrow. It deals with a single patient usually. Length time bias deals on a population level. That's why you have these multiple arrows, because it's like it deals with the attributes of a screening test, with the screening test. Now let's understand it. So before the 1970s and 80s, what was happening was that very few people were getting prostate cancer symptoms and they were dying, right? And these were the people that we were diagnosing. These are the people that we were diagnosing. They were living almost 1 to 2 years and then they were dying. And a lot of people actually had prostate cancer and they were not dying. But we didn't know that, right? We didn't know that. We just knew that prostate cancer is very, very bad. People get diagnosed with it and then they die very, very quick. They die very, very quick within a year or two. Then suddenly we had this new thing called PSA. And on the basis of screening tests, now we were diagnosing so many people. Right? And this is now, if you look at this time span, if these were looking 1 to 2 years, so these were living these were living 5 to 6 years, or maybe they've not even 5 to 6 years. They just kept on living. They didn't die because this was just not a bad disease to have. So we started saying that somehow our screening test has improved the mortality. Because earlier, as you can see here, on the basis of symptoms as we were diagnosing people. We were getting only 1 to 2 years. And then we had people who just did not die. So our screening tests somehow increased the mortality. But no, that was wrong perception. The real perception is that it's just a very, very good disease to have. This disease, prostate cancer, was a good disease to have. These patients did not die. What you were doing is that on the population level, you're just diagnosing a lot of extra people with the disease who wouldn't have died either way. And now you're getting this false perception of increased living in your patients. But the thing is, the people who still have advanced cancer would die either way. This is the concept of length time bias. When you're diagnosing these extra people with very good disease who keep on living, and then you say that somehow our screening test has improved the mortality because we're getting now a lot of people who are living with the disease and we're treating them as well. And all of these people started having surgeries, and all of these people started having treatments. And then at some point someone said, no, you don't need to treat prostate cancer all the time. Just stay. Now they have something where they just stand behind, they keep observing the patient, and if the patient develops symptoms, if the patient develops a large carcinoma that comes out of the prostate, they only operate then. They don't operate on everyone for prostate cancer now. So this is the concept of length time bias, which is a slow progressive disease. Don't do anything. Your screening test is just diagnosing very good people with the disease who would have lived either way. This is the concept of length time bias. Now let us put both of these side by side and try to understand. I know this is a confusing topic, but this will be very simple in a few seconds, and all of those examples will start to make sense now. So what we're doing in lead time bias is we're diagnosing someone with very advanced disease earlier without a change in their outcomes. Remember that pancreatic cancer arrow, we're not changing, we're just diagnosing people earlier. They still have very aggressive disease. What are we doing with length time bias? We're just diagnosing a lot of people with very good slow growing disease, and we're treating them like crazy even though they wouldn't have died in the first place, even though nothing bad would have happened to them in the first place. This is length time bias. You're just diagnosing a large amount of people with very good disease to have, and then started treating them like prostate cancer. What happens in lead time bias? You get this falsely increased survival time, but you're not doing anything for the disease. You're just diagnosing it earlier. What happens in length time bias? You overestimate the efficacy of your screening program. You overestimate the efficacy of PSA, that somehow PSA has improved the mortality in prostate cancer. But the thing is, you're not now just getting extra very good people with the disease. So always remember, for the purposes of your exam, when you'll get length time bias, you'll get slow growing disease. When you'll get lead time bias, you'll get advanced bad disease. One other difference, lead time bias is usually for diagnostic tests, and length time bias is usually for screening tests that deals with at a population level, and therefore we overestimate the screening program efficacy. So let us do some practice questions to hit hard this concept that we just studied. So I usually write very long-winded questions because that's how biostats usually is tested, because they want to confuse the test taker with these very long questions, even though the topic, the subject matter itself is very easy. A new screening test for lung cancer is introduced and is found to detect tumors earlier than previous method. A study compares patients diagnosed through this new screening method to those diagnosed by conventional methods. The result shows that the patients diagnosed with a new screening test have a significantly longer survival time after diagnosis compared to those diagnosed conventionally. Okay, so what we are doing is that, however, further analysis reveals that the actual time from the onset of disease to death is similar in both groups. Now, without this second paragraph, I was also kind of lost. So I make these questions, but I don't memorize them because I want to solve them with you. So, however, further analysis reveals that the actual time from the onset of disease to death is similar in both groups. Basically, we are not changing the disease lifespan. We're just diagnosing the disease earlier. That sounds very similar. What does that sound like? What type of bias is most likely responsible for the apparent increase in survival time observed in patients with this new screening test? Is it confounding bias? I talked about confounding bias in a previous video. Confounding bias is basically when you get this third variable which explains the association between exposure and outcome, which I don't think is the case here. So it's not confounding bias. Recall bias is a type of information bias I talk about in a previous video. Recall bias is bad. People with very bad outcomes tend to remember diseases very easy, their negative exposure very easily, and it happens in case control type of studies. So no. Selection bias is when the sample you choose for a study differs from the actual population you want it to represent. So I don't think it's that. So now we have our two major contenders, lead time and length time bias. But if you just look at this subject proposal, if you just look at this part of the question, which type of bias is most likely to be responsible for the apparent increase in survival time observed in patients diagnosed with this new screening test? So as the previous question also said, we're getting this apparent increase in survival time without doing much for the disease. So that is lead time bias. There is a reason I try to make these questions a bit confusing. Why is it not length time bias? Because they did not say this was a very, very slow growing disease. So now let us look at this question. A population-based breast cancer screening program is implemented and the incidence of detected breast cancer cases increases. Okay, most of the cancer identified through the screening are low grade and slow growing. Wow, we know that. We know what that sounds like. While the cancer identified in symptomatic patients tend to be more aggressive and advanced. A review of the program shows that patients diagnosed through screening have longer survival time compared to those diagnosed due to symptoms, even though the treatment protocols and outcomes for advanced cases are unchanged. So if you just focus on what this wants to say is that people who are diagnosed through screening, they have low grade and slow growing tumors, and the patients who have symptoms, meaning breast cancer symptoms, they tend to be very aggressive and advanced tumors. Right? And now we are getting this somehow the increase, we are trying to say that somehow our screening program is working very well and it's diagnosing a lot of people with the disease. What does this sound like? Which of the following best explains the observed survival difference between screened and symptomatic patients in this scenario? You want to answer this question? So let us start together. So is it publication bias? I talked about publication bias in my previous video on information bias. It's a subtype of information bias, and it's selective reporting of data to skew the information a little bit, which I don't think is happening in this case. Information bias occurs when you have an inaccurate reporting, measurement and interpretation of data, which I don't think is happening here. Confounding bias is when a third variable is hiding in the background, explaining the association between an exposure and outcome, which I don't think is happening here. And now we have the final two things here, lead and length time bias. But we know that I told you that if they want you to pick length time bias, they will tell you that this is a slow growing, in a screened patient it's a slow growing disease. So therefore this is length time bias. This explains the survival difference between screens and symptomatic patients in this scenario. So in the end, thank you so much for watching this video. As always, every day is a new beginning. Thank you.